Welcome to the Deep Dive. Today, we're diving deep into a really critical global issue, the health and well-being of refugees.
So it's a huge topic.
Yeah, huge. And we're going to really try and explore the significant challenges they face in getting the healthcare they desperately need. And we'll also look at the dedicated efforts being made to, make a real difference.
It's definitely multifaceted. Understanding both the difficulties and the work being done, that's essential.
Right. So you, our listener, shared two really informative pieces with us for this.
Yeah, great sources.
The first is from the Palestine Children's Relief Fund, PCRF. And this one gives a sort of broad view of healthcare access in refugee camps generally.
It sets the stage, lays out the landscape.
Exactly. It helps us understand the kinds of health challenges that pop up when people are displaced living in these often temporary settlements.
Yeah, the PCRF piece is a good starting point, really helps grasp the basics.
And the second piece you sent is a comprehensive review. It was published in the Eastern Mediterranean Health Journal.
Right.
Now, this one takes a much closer look, a real deep dive into the specific health challenges, the specific barriers for Syrian refugees in Jordan.
So it zooms right in.
It does. While PCRF gives that wider lens, this journal article focuses right in on one group in one country.
Exactly. It gives that detailed perspective, the specific health concerns, the obstacles for Syrian refugees within that Jordanian context.
So our mission today, really, is to pull out the most important insights from both. We want to give you a complete but easy to understand picture of this really complex situation.
Not just skimming the surface.
No, definitely not. We want to pinpoint the actual struggles, but also highlight the incredibly important work being done.
Sort of fast track to getting informed.
To think of it that way, yeah. Your fast track to really understanding refugee health. Okay, let's really unpack this.
Okay, so where should we start? Maybe with the general situation in camps using that PCRF info.
Sounds good. What are the big health problems they flag?
Well, the PCRF article makes it super clear. When people are forced out, end up in camps, they face a whole range of health issues almost immediately.
Right.
It emphasizes disease outbreaks and widespread malnutrition. These are major public health crises in those settings.
And not minor concerns, right?
Yeah.
So it can lead to really high rates of illness, even death, especially when people arrive with almost nothing.
That's exactly it. In those early emergency stages, you've got poor sanitation, limited clean water, not enough food. It's a dangerous mix.
Yeah.
Infectious diseases can just rip through a camp. And malnutrition, like the PCRF points out, especially in kids, it has severe, long-lasting effects. Physical, mental development, all of it.
And it's crucial to remember it's not just physical health. That's something the PCRF really highlights too. The mental health side.
Absolutely.
They specifically mention PTSD, post-traumatic stress disorder. It's often more common among refugees than in, say, the host communities. And then you've got depression, anxiety, also really prevalent, often linked directly to the trauma of fleeing, the difficult asylum process, just the harsh conditions.
It's such a critical point. We can't overstate the psychological toll. Experiencing conflict, loss, then facing this uncertain future, it's deeply impactful.
Yeah.
The constant worry about legal status, the stress of adapting, it all adds up to this huge mental health burden.
The PCRF also brings up sexual and reproductive health, another vital area.
Often overlooked.
Yeah. They point out that problems during pregnancy and childbirth become much more dangerous in emergencies.
Right.
And tragically, these situations also increase the risk of gender-based violence, which hits women and children hardest. It's a really worrying picture.
It is. When social structures break down and people are so vulnerable, it can worsen existing inequalities and create new dangers.
So access to reproductive health care, protection from violence, it becomes even more critical.
Absolutely essential.
Then there's the fundamental issue of just getting health care. PCRF notes refugees often hit major obstacles: legal status, language barriers.
Discrimination, too, sadly.
Yes, discrimination.
Yeah.
Which is exactly why PCRF stresses how vital it is to provide health care to all migrants and refugees, regardless of legal standing. It's a basic right.
And these barriers, they're complex, aren't they? Legal rules might exclude them. Language stops communication with doctors.
Yeah.
And discrimination, whether it's systemic or personal, can just stop people from even seeking care or mean they get worse care.
But on a more positive note, PCRF does talk about public health efforts in camps.
Right, the interventions.
Yeah, aiming to meet basic health needs.
Right.
And importantly, they mention these services are closely linked to nutrition programs and wash each water, sanitation, hygiene.
That integrated approach, Makes total sense.
Yeah, because it's all connected, isn't it? Preventing disease, maintaining health.
Absolutely vital. Good water, sanitation, hygiene. They're fundamental for stopping infectious diseases in crowded camps.
Okay, so that PCRF article gives us that really important broad understanding. General health challenges in camps. Now, let's switch focus. Let's look at that review from the Eastern Mediterranean Health Journal, the one on Syrian refugees in Jordan. What specifics does that study give us?
Right, so this review, it compiled findings from several studies on Syrian refugees in Jordan. It really digs into the specific health conditions and the specific access barriers.
And does it confirm the broader challenges PCRF outlined?
It does, yes. Many of the same themes emerge, but with more kind of granular detail for this specific population.
Like mental health. Did the review find that was also a big issue for Syrians in Jordan?
Oh, definitely. The review found emotional and mental health problems had a prevalence of nearly 33%, almost a third.
Wow.
Refugees reported lots of signs of psychological distress, stress, anxiety, fear, anger, and really sadly, hopelessness and depression.
So it echoes that PCRF point about the mental health burden.
Very much so.
Okay, what about physical health? What kinds of diseases were most common among Syrian refugees in Jordan, according to that review?
Okay, so the review indicated chronic diseases affected about 29%, long-term stuff.
Like what?
The most frequent were hypertension, high blood pressure, diabetes, musculoskeletal issues, and cardiovascular diseases. Heart problems.
Okay.
But they also found a really high prevalence of communicable diseases, infectious ones, around 43%.
Higher than chronic.
Yeah. Among those, influenza, the flu, and infectious diarrhea were particularly common. So they're dealing with both ongoing chronic issues and acute infectious illnesses.
That makes a lot of sense. Unfortunately, people arriving with pre-existing conditions.
Right.
And then
Yeah.
the stress of displacement probably makes those worse. Plus the higher risk of catching things in crowded conditions.
Exactly. And the review points out many chronic diseases might have been diagnosed before the war. Displacement just wrecks their ability to manage them. Lost access to care, medication.
Yeah, okay. So the PCRF article mentioned access to care being a hurdle generally. What did this specific review find about barriers for Syrian refugees in Jordan?
This is where the review gets really specific and, frankly, quite stark. They found financial issues were, by far, the biggest barrier,
How big?
affecting a staggering 66% of refugees surveyed across the studies. 2/3.
Wow, 66%.
Yeah. And that wasn't just the cost of seeing a doctor. It included the cost of medications, which can be substantial, and even just transport to get to a clinic.
That's huge. It really highlights how even if services exist, if people can't afford them or can't afford to get to them.
They're effectively inaccessible.
Right. I remember reading in the review something about a difference between refugees in camps versus outside.
Yes, that's the key point. Those inside camps often had free or heavily subsidized access, at least initially, but those living outside camps, in towns and cities, were often treated more like uninsured Jordanians.
Meaning significant out-of-pocket costs.
Often, yes. And the review noted that both groups, inside and outside camps, reported financial barriers. Even camp residents might need to pay for certain services or drugs at private centers.
And transportation costs.
Especially high for those outside camps, as clinics could be far away.
Okay, so finances are massive.
Yes.
Were there other major barriers identified in Jordan?
Yes. The review also highlighted the unavailability of necessary medicines and essential medical equipment. That affected about 27%.
So nearly a third facing that too. What does that mean practically?
It means you might see a doctor, get a prescription, but then you can't actually get the medicine. It's out of stock or just too expensive even with the script.
Right.
The review also mentioned structural barriers, lack of specialists in local centers, for instance, and unfortunately, sometimes facilities or staff refusing services to refugees.
That's awful.
Yeah. And lack of medical equipment was also a concern, though reported less often than cost or medicine availability.
So it's not just about money. It's also about whether the resources, drugs, equipment, the right doctors are actually there when needed.
Precisely.
And what about just knowing where to go? Did
Where?
the review look at awareness of services?
It did. And lack of awareness was reported as a barrier by around 21%, so about 1 in 5.
What kind of things didn't they know about?
Not knowing about UNHCR-supported facilities or free vaccination programs or even subsidized access to government primary care clinics.
So help might be there, but people don't know about it or how to access it.
Exactly, which shows that communication and outreach are absolutely crucial.
It really paints this picture of a very complex web of challenges, doesn't it?
It does.
You've got the physical and mental health issues, often worsened by displacement. And then these huge barriers stopping people from getting the care they need.
Yeah.
It feels, well, overwhelming.
It is a massive global challenge, no doubt, but it's also really important to acknowledge the efforts being made to address these issues.
Right, the positive side.
Yeah. The PCRF article, for instance, talks about their own work, providing humanitarian aid, medical relief through various programs targeting vulnerable kids and families.
They mentioned volunteer doctors, too, didn't they?
Yes, volunteer doctors and specialists working to improve pediatric care in the region. Real hands-on work.
In the Jordan review, it also touched on responses there, right? Mentioned UNHCR plans, the Jordanian government's plans.
That's right. Things like the UNHCR's Regional Response Plan and Jordan's National Resilience Plan. These are big, comprehensive efforts.
What's the main goal of those?
To coordinate a wide-ranging response. They cover multiple needs. Healthcare is key, but also things like cash assistance, education, food security, mental health support, trying to bring a more systematic approach.
And we also got a glimpse, didn't we, from some of those other articles you shared for background, like from Mercy Corps and Oxfam, about daily life.
Yes, those personal stories add so much. That piece about Noor and Zatari camp, fetching water multiple times a day, struggling for food.
Finding a quiet moment.
Yeah, it shows how basic needs become huge undertakings.
And Zatari, as Oxfam described it, it's basically become a semi-permanent city now.
It has, with all the infrastructure challenges that implies. Oxfam's work there on water, sanitation, building that water network, that's huge.
And that recycling project, too. Turning waste into work.
Yeah, really innovative. It tackles waste and provides livelihoods. Shows that multifaceted approach needed to improve conditions and health.
And Oxfam's work on gender equality there, too, improving women's skills, economic participation. That seemed important.
Critically important. Because those broader social factors like gender inequality, lack of opportunity, they are absolutely determinants of health. Empowering women helps everyone.
It's just so clear that ensuring refugee health is this massive, ongoing task. Needs immediate aid, but also long-term strategies, lots of collaboration.
International organizations, governments, NGOs, everyone has a part to play.
So let's try and sort of pull this all together. What does it all mean for refugee health globally? We've seen how vital healthcare access is in camps. Disease outbreaks, malnutrition, huge threats.
Constant threats.
And the mental health toll, PTSD, depression, anxiety, often much higher than in host populations.
Definitely.
Reproductive health, especially for women and kids, big concerns there too, often worsened by the risk of gender-based violence. And then those fundamental barriers, legal status, language, discrimination, just blocking access to care.
And focusing on the Syrian refugees in Jordan, that review really drove home the chronic diseases, the communicable diseases, but also that the burden goes way beyond just illness.
The financial barriers being the biggest one.
Absolutely massive, affecting 2/3. Cost of services, meds, even transport, just stopping people getting care.
Plus the lack of available medicines, equipment.
Right, and that lack of awareness about what services even exist. It's a complex knot of problems.
But the work of organizations like PCRF providing that direct relief, that matters.
Hugely. And the efforts in Jordan to integrate refugees, coordinate responses through those big plans, those are crucial steps.
Yeah, the UNHCR plan, the government plan.
And seeing how a place like Zatari evolves, the challenges, but also the initiatives like Oxfam's work on water, sanitation, waste to work, it shows the complex support needed.
It really does showcase that multifaceted nature you mentioned earlier.
Ultimately, what these sources really underscore is that refugee health isn't just about humanitarian aid. It's a major global issue. It needs sustained attention, real resources.
Yeah.
The challenges are huge, complex, but the efforts to bridge that healthcare gap, they do offer, a glimmer of hope.
This deep dive, hopefully it sheds some light on just how complex this is and the critical work happening.
We hope so.
And we really encourage you, our listeners, to maybe explore the work of organizations like PCRF, UNHCR further.
Yeah, see what they're doing on the ground.
And maybe just think about the implications. What does it mean for global health when so many people are displaced? What's our shared responsibility for their well-being?
Those are the big questions to keep mulling over, aren't they?
They really are. So if this exploration sparked your curiosity or maybe gave you some valuable insights, We'd be really grateful if you'd subscribe to the Deep Dive.
Let us know what you think.
Yeah, leave a comment with your thoughts, maybe any follow-up questions you have, and give us a like.
Your engagement really does help us keep bringing these kinds of in-depth analyses to you.
It really does. Thanks for joining us.